In Rwanda's capital, Kigali, 3-year-old Eve Twemerimana is fighting for breath against the country's biggest killer of children, pneumonia. But he's one of the lucky ones. His mother brought him to hospital on time, and he's slowly starting to recover.
On a Monday, my child was coughing and had a temperature, so I took him to the health center. His temperature was about 40. They told me he has pneumonia and he was transferred here.
Many are not so lucky. Pneumonia is the biggest killer of children under 5 worldwide and accounts for almost 20,000 deaths in Rwanda each year. This despite the fact that the disease is largely preventable and treatable.
Pneumonia is the biggest cause of death in children under 5. This is the case all over the world, and it's verified right here in our country.
The leading cause of pneumonia is pneumococcal disease, which is vaccine preventable. Last year, with support from the Gavi Alliance, a partnership that includes donors, UN agencies and NGOs, Rwanda became the first low-income country in the world to integrate pneumococcal vaccines into its routine immunization program. It's early morning at the Nyamata Health Center in Bugesera district, but mothers and babies are already packed onto small benches in the waiting area, and more continue to arrive on foot. The government's emphasis on community health means that most families live within 5 kilometers of a health center. It's part of a bottom-up approach to make sure that public health services are available in even remote areas and reach the poorest people. Once settled, the mothers are given lessons in health, hygiene, and exclusive breastfeeding. And then, the vaccinations begin. Rwanda's government has made huge strides in child health over the last 10 years. Vaccination levels have reached over 90%. It's one of the few countries in the region on track to reach its Millennium Development Goal on reducing child mortality. Administered alongside other routine vaccinations at health centers like this one throughout the country, compliance with the pneumococcal vaccine is high. Although it's still too early to gauge its impact, health workers are already reporting a substantial reduction in pneumonia cases.
We used to see many cases related to pneumonia each month, but ever since the introduction of this vaccination program, we've noticed that cases decreased, and we can often have a whole month without a single case of pneumonia.
The vaccine also protects against strains of meningitis and septicemia, and it is hoped will save the lives of around 6,000 children under 5 each year.
Rwanda has successfully introduced pneumococcal vaccine in 2009, in April 2009. And we are really here to see the first results of that. And this ward we are standing in is actually showing part of the result.
Rwanda's health system has become a model for developing countries. Systematic and effective, it is, through partnerships, saving children's lives.
This is Guy Hubbard reporting for UNICEF Television. For more information, go to unicef.org. Unite for Children.